Okay, DMC is here this morning with Dr. Louis Francescutti, an emergency and medical physician and also a university professor in Edmonton. Um, Dr. Louis has obviously spoken for us before a couple of times in our in-person conferences, sharing his vision for digital triage and also the need for root cause um, treatment in emergency centers. Dr. Louis, welcome back to DMC.
My pleasure.
So I've got a couple of questions for you I'd like to explore. Technology is seen as a facilitator in many industries and a source for competitive advantage. However, in supporting some of our more vulnerable populations, there are specific challenges around that. Can you maybe just maybe dig into that a little bit?
Well, I think the important thing, Wade, is to understand that folks that are experiencing homelessness, especially now in the middle of a pandemic, have very special needs. They've always had special needs, but in the middle of a pandemic, they really have special needs. And so they've got many different touch points. And a touch point to me is a source of data. And so if we were able to link all those different touch points together, I think it would become obviously clear quite quickly that it's very expensive to try and help someone that's in homelessness, as opposed to just taking the bull by the horns and saying, listen, this person's biggest problem is they don't have a roof over their head. And if they don't have a roof over their head, that means they're more likely to interact with police. There's one data point. They're more likely to interact with fire services. That's a second data point. They're more likely to interact with emergency medical services. That's the third data point. Mm-hmm. Then if they end up in the emergency department, there's a whole bunch of data points that are generated right there. And then if they have to go out to a shelter, there's another data point. Then if a social worker's involved, there's another data point. And then if they have to go to rehab for, let's say, if they have a substance abuse issue, that's another data point. Then if they have a mental health issue, that's another data point. My point is there's a lot of data points. And unfortunately, they all reside in different silos. And so when you're only looking at one silo, it doesn't look like it's a big problem. But if somebody was to say, hey, let's link all these together and find out what the true cost is trying to support someone who's homeless out there, I think it would become fairly obvious for decision makers and policymakers that they're not doing a terrible job. They're doing a horrendous job in dealing with this problem. And so till people that control the purse strings really understand how major this problem is, we continue to get these anemic, piecemeal, pathetic responses that are not serving their needs and are tying up a lot of resources that could be better directed. You know, I've always said, and I get in trouble for saying this, but poverty is big business. And there's a lot of people that make a very good living off of other people's poverty. And what we need to do, using the power of data and data mining, is to, for once and all, say, listen, it's just too expensive to try and take care of someone who's homeless. Let's give them a roof over their head and let's start supporting these individuals so that they can get back to being productive members of society like they used to be. And then for probably no reason of their own, you know, they ended up homeless.
I think this is actually some of the work that you're doing as well. You're involved in a couple of projects in that space, but we talked about what the challenges are, and you've also alluded to some of the opportunities. But let's just unpack that a bit further. The opportunities to actually use technology to make things better.
Yeah, the problem is that everybody comes back with the standard. It's not my job. It's not my responsibility. I got into a little argument with a psychiatrist the other day where they're trying to do stuff for patient. It's not working. And then, you know, they put up their hands and say, well, it's not my job to try and find them a house. My point is, it is your job to try and find them a house. I mean, if they don't have a house, that's the most basic of human needs, Maslow's hierarchy. You need a place that you can call your own. It doesn't have to be special. It doesn't have to be fancy, but it needs to be a place you can call your own. And so the only way we're going to be able to get that is to show, as I said earlier, the people that control the purse strings, that it's cheaper to house someone than it is to develop all these systems after the fact. And unfortunately, everybody passes the buck on this one. No one wants to accept responsibility. You know, municipal government says it's a provincial responsibility. Provincial governments say it's the federal responsibility. The federal government says, well, no, it's back to municipalities. And so, it's a political nightmare. And unfortunately, real people, real kids, real women, real men, are caught in this real mess. And so we've already developed a system that, working with students at NAIT, they've developed an app to place any homeless patient in the emergency department. But when you try and start working with hospitals, it's, well, we don't want to give up that money because it's in our budget. And if we give it up, then we lose it. It's just insane that nobody is taking a little bit of leadership. And in pandemics have really brought out how vulnerable these homeless populations are. And they're more likely to get, coronavirus, and they're more likely to get pneumonia. They're more likely to die as a result of not just having access to a place where they can self-isolate. So, collectively, we should all be ashamed of ourselves. And maybe your community can be the ones that, generate the information that just is presented to governments where they go, wow, we really have to do something about this. Not today, but yesterday.
That's interesting, that last comment, actually, because I recall at one of our last conferences, I believe it was Edmonton, you gave quite a striking presentation around the whole creation of the support network, from the family unit to the social supports. And you actually invited, we had, I think, 230 technologists and technology professionals in the room. You invited their input and their collaboration. I thought that was really quite a powerful request. So here we are. I'll be publishing this on our site and on YouTube. So openly, you are looking for collaboration, in fact, from technologists and people in the industry to help you solve this issue.
Well, absolutely. I mean, the men and women around the table that are listening to this podcast have the answers. They have the technology, they have the means, and some of them work for organizations that might be interested in lending a hand as well. So I'm not a kind of person that sort of sits around and just, cries, we need to do something. I like to do it. Maybe it's the emergency doc in me. So this is something that needs to be solved. And don't look to politicians and don't look to bureaucrats to solve it, because they're not going to solve it. They've had plenty of opportunity to solve it, and they've dragged their feet on it. A lot of lip service. Lip service is pretty cheap. These people need a place to stay tonight. So anybody out there interested, we'll show you what we did. You can come in and stress test it. You can try and make it even better for us. And then we've got a pilot that's ready to go. We just need to raise piddly, I think, 1.2 million to support it for 3 years. And 1.2 million is nothing, because it costs about 200,000 just to support one homeless individual. And it's estimated there's about 3,000 homeless individuals in Edmonton right now. So you figure the math on how much we're spending, as opposed to doing a pilot, showing it works, and then just ramping up that pilot so that we can get people into permanent housing and get them the permanent work that they need so that they become taxpayers and, productive members of society and healthier members of society as well.
It's really compelling numbers there, Dr. Louis. Thank you for that. We'll share that for sure in this recording. The last question I have for you was around how people experiencing homelessness react to actually being faced with technology. Often it's actually a reaction of fear. They don't want to interact with that technology, or even they don't want to necessarily share their information. So how do you see technology adapting to deal with that kind of barrier to being able to leverage this tool?
Yeah, no, I think that the reality is that most people that are experiencing homelessness are quite tech savvy, believe it or not, because a lot of them spend time in public libraries that give them access to the internet. They interact with so many agencies that use technology to capture information. And, the majority of the ones that I've spoken to really don't care too much if people are sharing information about them, simply because they just want to get a meal in their belly, a fresh set of clothes, a shower every now and then, and a place that they can close their eyes and not worry about somebody stealing their stuff or, assaulting them. So I think that they would be more more than willing to, get involved as part of the solution. And the first people I would hire is people that have experienced homelessness. I mean, I've never experienced homelessness other than maybe 1 or 2 nights when I was hitchhiking. But I can tell you that people that have lived on the streets have the life experience that would help us put these programs in place, because you can't bullshit someone that's been in the trenches. And if, they're trying to help someone and that person's trying to put up all these artificial barriers, these folks will cut through it quite quickly. And if we empower them with the tools and the technology and the training, they'll be able to capture information, and then we can use that information to make a difference. I mean, this is a problem that's solvable. We could solve this problem within months if we really wanted to, and if we didn't put a complicated bureaucracy around it. Because the moment you put complicated bureaucracies around issues, why would they want the issue to disappear? I mean, does it make sense to build a homeless shelter? Because then you need homeless people to run your shelter. The idea should be to dismantle homeless shelters and put that money into housing so that people don't need homeless shelters. The longer you keep building homeless shelters, the longer you're going to need to have homeless people to fill your shelters. It's a self-fulfilling prophecy.
Really interesting stuff, Dr. Louis. I'm really looking forward to the talk with yourself and Helen Knight on January 6th. Thank you for the time you've taken with DMC today, and I'm looking forward to speaking with you again at the event.
Great. Thanks, Wade. Be safe out there.
You too. Bye-bye.